We are here again. My name is Amuan, as always. So I'm the host of Addressing the Youth Friendly podcast. So today we have our special guest. Sister Lauren, can you say hi to the viewers?
Hello, how are you? Sister Lauren here.
As usual, I have my guys here. This is Dixon. I like to call him Mr. Jerry. Mr. Jerry here, and he's the friend. Felicitas. So guys, today we are having a very interesting topic. Meanwhile, Timon have not my confusion. I mean, about to differentiate what is PEP and what is PREP. So we're having that. So we also invited Sister Ren here to help us to differentiate what is PEP and PREP. So Sister Ren, anything to talk about PEP and PEP? Or maybe we can start with PEP and then go to PREP.
Okay, so PEP is a pre-exposure prophylaxis.
Pre-exposure prophylaxis.
So what I mean by pre-exposure prophylaxis is PEP is when you take it immediately when you're exposed. Okay. So, and the hours where you need to take PEP, it's only 72 hours. After 72 hours, it's not effective. So let's say, for example, or before I go to examples, I'll ask either of you or any of you any exposures that you know that can make you take PEP.
Alright, like to me, I can say maybe HIV, right?
Yes.
If you see someone like
there have to be someone who's HIV infected and
Alright.
someone who's not HIV infected.
Okay.
Yes. Okay, what you know before I clarify?
Not much. What do you know
About PEP?
Yes. How does someone get exposed?
For example, like through needles, like someone who is HIV positive has been injected with an injection, and you are negative, you got injected with the same injection or the same equipment.
Or you did not wear the gloves when giving the treatment.
Yes.
So I'll add on. Not only we don't give PEP only to people who are HIV positive, especially in that scenario. You may find that you're on the ward, you don't know my status, and you know your status, or maybe you might have tested 3 months ago or a year ago or whatever. Just to be on the safer side, you need to test yourself, test your is it a patient or client or whoever it is that you're exposed to. For conscious sake, why am I saying conscious sake? There's window period. Okay, you might find that you're exposed to this person, her blood or whatever needle prick, whichever way that you got exposed. You do HIV test, you also need to do their HIV test. Let's say, for example, her HIV test is negative. You are not safe on that one. You are not 100% safe, especially if she doesn't have a file with ART or anything. Why am I saying so? We're talking about window period. She might be infected, but then it's not showing. That's the simplest way to do, the way to use. And then the other thing, just to add on, since I'm talking about how, when do you need to take PEP and why? What are the reasons? Okay, Makapesa ili negative, mostly our clients or our people whoever come bazasida pamene hapo because ayachoka negative, nine ni negative. To be on the safer side, cover yourself with PEP.
Okay.
And then for you, if you, it's up to you, since VCT is voluntary. If you want, again, you can test yourself after 3 months. Again, after 3 months until you're satisfied that you're negative. But for the one who's exposed, you need to start PEP. I'm talking about what?
PEP.
Pre-exposed. For how many days? 28 days. Okay?
When they did that makes a month.
Yes.
Alright.
And then, when do I need to start PEP when I'm exposed? 72 hours. 72 hours is 3 days. Okay? The day you're exposed, the other 24 hours, and the 24 hours, which makes it how many days? 3 days. Within these days,
So
that's when you
so
can
you
start.
start from day 1, then you continue for 3 days, or you start
No,
even
no,
from
no,
day
no,
3.
No. What I'm trying to say is, let's say for example you're exposed today on the 10th of July, you are not ready to start. You're thinking otherwise, maybe all those emotional, psychological, whatever. We are still giving you a chance according to what is there written in the books or whatever science that they can use. You can also try the other day in case the first day you are not ready. If you're not ready the second day, you have one last chance, which is the third day. Okay? Ungayese okokuyesa si period chabe yofuna kuyesela. That's the only time it can be effective. If that person is infected, the one you got exposed to, at least before the virus can invade into your system, there's these 3 days pameka kachiri kusoga mutupi kuti kachite chani kachite penetrate. So within these 3 days you are able to block it by taking what? After 3 days or after 72 hours. It's 50-50 depending on the what? Exposure. Needle prick usually we say it's 0.0, which is very minimal. Chances are very low for you to get infected, but just to be on the safer side, and we don't know how intense it is, you have to cover yourself with PEP. So we are done on the needle prick side. There's also sexual assault. We have physical assault, because as we know HIV, the only transmission that we know that HIV, someone can get exposed with HIV are 3 ways. Okay? It's either sexually, okay? It's either through breast milk, it's either all those physical assaults, whatever sort type of assault, name them. On assault nyambidi, physical assault away from sexual assault. In an accident, you're positive, or I'm also positive, or even you, or maybe 2 of us or 3, or just the 2 of us, me positive, you negative, we find ourselves maybe in an accident. Does it cheap? That it for as long as there's an opening, and I have an opening. What is an opening? Gilonda. Whether that is umbrella, in whichever way they can die.
So I have a question. How many fluids? Like, is it blood only where you can get HIV?
3.
I'm saying blood. Is it blood only, or you can get HIV through saliva or what?
No. 3. Okay? There are 3. 1, semen. Men, you know what semen is, eh?
Yes.
Semen. HIV is found in semen, not sperm, but semen. Okay? And then 2, breast milk. 3, blood. Ndiye mwamene mpezeka HIV mumate mulibe HIV. Okay? In a sperm there is no HIV. If there was HIV in a sperm, most of these children would have been positive who are born now. Okay? Why is there mother to child transmission now? Why is there PMTCT? Because we are considering those breastfeeding. Breastfeeding, we're also considering sexual and assault. Sex is according to the way we are, and that's why we emphasize on what? Condom use. How do we get it sexually? It's not through those sperms, no. It's through a friction under those cuts and what, and then there will be an opening. And make clear on that one.
So just one question. We said there's even babies, right? So how do you protect them, like for them not to get infected by their mothers?
PMTCT, that's what we're talking about now. PMTCT, 1, we have to start with the mother before the baby is born. Okay, we have to make sure the mother is on ART with good adherence. Adherence, you know what adherence is. Yes. Without miss us, good time and everything. We monitor the mother. Next, viral loads of the mother. Every mother who's HIV positive and pregnant, we make sure that they do their viral load. We monitor them every 3 months when they come to do their drug collection. Okay? As we monitor viral load, we have to make sure their viral load is less than 1,000, preferably at 0. Okay? Then we know that the mother is and the virus is undetectable and untransmissible, which gives lower chances to transmit to the what? To the baby. When the baby is born, this routine viral load checkup and medicine or what, and okay, in short, we say they are not stable clients, because of the shani mimba. Every 3 months we'll be doing viral load, drug pickup, viral load. That's how we monitor. When we maintain it at 0, even at birth, we'll still do. We're taking it to the child now, making sure that the child is okay. We'll do those DBS like a bad one after 6 weeks, after 3 months, after until the child is 2 years. Then you asked, how do we prevent it to the child? When the child is born, this is where we bring in prophylaxis now for the child. Akabadwa mwana kaja, we give AZT3TC just for 12 weeks. Kuti amo, because then in case we don't know, they will take that AZT3TC for 12 weeks. When they're done with AZT3TC for 12 weeks, we switch to Septrin. They will take Septrin syrup 5 ml every day, once up to 2 years.
So Septrin is also...
For as long as the mother is breastfeeding. Okay. Septrin is also a prophylaxis.
Okay.
If you remember back then, before we had so many drugs that we have now, we used to put people on Septrin. That's what they were taking before. When they naive, you know, HIV is too much research. Tomorrow they will say this is better than this. Try this, that. I've answered your nana.
Yes.
I'm done with the child.
Yes.
But again, on the child, if the mother feels like she's financially stable and she doesn't want to breastfeed the child up to 2 years, no, in an 2 weeks or 2 months or 6 months. We say no, there is no need to give the child prophylaxis. Okay? Now the child is on home foods. There is no exposure. This is another PREP, not PEP. PREP in a child. Okay? Now, the mother. That routine investigation, the 3 months one, still continues. For as long as she's still breastfeeding the child, it will continue up to the time the child stops breastfeeding. But if the child stops, mamena can be like for 6 months or what, even our routines also stop, provided the mother is still stable.
Alright.
If the mother is still stable, zero will stop. But in case something happens, then we'll continue. If it stops, once we cut and then we switch back to 6 months. That's it. I'll go back to PEP. So PEP, I explained, right? Before, pre-exposure, within 72 hours, you take the drugs for how many days? 28 days. First 2 weeks, we monitor you, see how you're going to respond to the drug. After that 2 weeks, you come back for review. Again, we give you the remaining drugs. And then when you come, we'll open a file for you. In case you are exposed, now when we want to visit a window period, from other exposures that you did not pay attention from, maybe within the period you're taking PEP, you transition one kind of HIV positive. We continue with the file, and then we initiate you and start doing other tests now. You are clear on PEP?
Yes.
Okay. So, meaning the next one is PREP, right?
Yes.
So PREP is after what? Exposure. Okay, post-exposure. I hope I'm not swapping them. Okay. There's PEP, PREP. Oh yeah.
So my question for PrEP. Can you stop drinking PrEP?
I'm on PrEP now.
Yes.
Though I swapped in pre-exposure and post-exposure, so we are now on PREP, which is PrEP. So for this one, for as long as, let's say for example, you two are a couple, I'm going to use the simplest examples. For as long as you two are a couple, this one is HIV positive. This one is so very much in love with the one who's HIV positive and they want to be together. You know when we start, facts are facts. Boyamba will follow rules. Condoms. Now you want to do it the right way. You come at a facility like this one, Tata Central Hospital. You seek for help. You find maybe me, okay, this and that. Now me as an advisor and as a health personnel attending to you, first things first, I'll ask you if you know her status, okay? Or you know it is after she confirm in case she's not our client. Or maybe if she's our client, she of course she'll prove it with her card or anything. From there, we'll send you to counseling moja. We do the counseling. After doing the counseling, they'll test you. negative, right? They'll give you something like this, a slip, to prove that you are negative. Then they would have talked to you about how to go about with PrEP, what, just to prepare your mind and to make sure that this is what you really want. Then, my part is for PrEP. For as long as I go back, you are with someone or you are exposed, you'll be continuously being exposed with someone who's HIV positive.
Yes.
Whether they are virologists, what, just on the safer
side.
part. Yeah. You have to take PrEP as your prophylaxis, so prevention in short, for you to get the what? The virus. Maybe even if she had a VO of 0 and detective and transmissible, whatever, you don't know what will happen. God forbid, we're not saying that. You have to be covered. Me, I call it covering, right? You start PrEP as a man who will give you, okay? Chiza kupasa na nkwala ya PrEP for 3 months. That's how we give. But starting, of course, chiza kuyamba first to test for 2 weeks. We see how you're going to respond in a month until you get your 3 months. Provided with the HIV negative what? Result. You start taking PrEP immediately when you feel like you want to start it. But exposure, it doesn't mean that you have to start exposing yourself immediately when you take PrEP. No, you have to wait for 7 days before you expose yourself. That's a man. Okay? Wayamba lelo so. Lelo 8, 10, 11, 12, 13, 14, 15, 16. You're going to take it on the 17th. I mean, that's when you're going to expose yourself. Then you are fully covered in a month. You will continue taking your PrEP for as long as you are still with her. Okay? Every 3 months after we have done our initial whatever, every 3 months we'll be coming to refill. When you come to refill your Truvada, that's the one we give, right? When you come to refill your Truvada, you still do your HIV test. 40, negative. That's why we said we might not know what happens with Sogolo. That's why we keep testing, and that's why we want you to be taking every day. Okay. That's PrEP in male. In females, the same way, but for females, you have to wait for 21 days. 1, 2, 3, 4, 21 days before you start exposing yourself. Okay. Also, starting provided with what? HIV negative. Yes.
So my question
days. When do you stop PrEP? That's a question you ask.
Another question. Before you
just for the sake of time, you know our sister here, Sister Roy, she's busy. Right? Yes. So just for the sake of time, we just wait for the questions. Let her first finish explaining, and then we can answer ask the question.
When do you stop PrEP? Immediately when you're off the exposure. Okay? Uziba, you're very sure atapachapa numba na alikefi. Unless there are other questions.
So I want to ask you.
Before you ask, one important thing. When you are on PrEP, both you have to finish continuous, non-stop.
Okay.
Unless ngati mwemene wake mufuno bala. And then we have to monitor her also. We have to make sure her vital load also
goes down.
Yes. It's a 0, 0, 0, 0, 0, 0, 0, 0, 0.
Okay. So as you mentioned that mufuno bala. So do you mean like when you're taking PrEP you can someone kind of member?
No. Family planning issues. Those are the things that you are trying to bring across now. Okay. HIV treatment or PrEP, PEP, which are the same drugs used in my ARVs, they are not for family planning. They are for HIV treatment and prevention. So, I was looking at her viral load. You are, as an example, you are not HIV positive. She's HIV positive, and you are seeking for what? PrEP.
Alright, okay.
Unless ngatimufuno bala, meaning we have to
To
focus
monitor the
also
virus.
on her. She'll continue with her routine. If it's 6 months, every 6 months or whatever, making sure that her viral load is what undetectable and untransmissible.
Alright.
That's when we start combining mandate. I'm going to someone a PMTCT or EPMTCT, mother to child prevention and elimination.
Alright.
You had a
Your question.
The question I wanted to ask, yeah, since you said every time before you start exposing yourself, you're supposed to drink PrEP for 7 days before you expose yourself. So I'm saying after being exposed, again for you to be exposed to your partner, you're supposed to drink again for 7 days.
No. If you put 1 and 2 together, after being exposed, you have to wait for 7 days. Again, I have to wait for 7 days. When you put them together, how are you taking it? You're taking every day, isn't it?
Yes.
So now, get back to your first question. Before the medication or the drug can invade your system, it has to be 7 tablets.
So how about
Put
that?
kazikika.
Now in which it says that if you want to expose yourself like immediately today, then you have to take 2 tablets.
No, there's nothing like that.
So
Unless
we have
if
a
there's
week.
just something I don't know, I haven't read or I haven't heard anything like that. I'm actually hearing it for the first time.
The problem is that as youths, we usually we make our own decisions.
You are overdosing yourself, and these are the reasons why in the future you're going to be having problems that you won't even understand.
Like I come across about this thing like they see you and also. So that's a friend of mine that come, boy, I'm in need of a PrEP now. You have to come to the hospital first, get tested before I give
you. You might be thinking you're giving PEP when you're treating someone. You get my point, eh? That's why we insist you come to the facility first. You do your HIV test and do all those needed or required routines or investigations. Because let's say I'm calling you, I'm being exposed today. I'm calling you my friend because I know you are my friend. You know people who always always
come.
Help me, get me this. I don't want to come to
the hospital.
Or maybe I have phobia of doing an HIV test.
Who
knows? Maybe I already have it. Okay.
On that. Most people
yes.
Nothing else.
Who knows? You even joke, you even say, nina dabanezo vila tufuba fuba na bana mo PrEP na bana vila tupia kosa. You have actually heard of those jokes? Not that they are sick or what. Sometimes even America, there are a lot of viruses that we can have in the body.
Yes.
Okay? The virus will always respond to any medication that is biological or whatever. But my point is, why do we advise for people to come to the hospital? You might be thinking you're taking PEP, actually you're treating yourself when you already have the virus. And then I think it's much not safer when you start taking medication. This is a person who doesn't know if they're sick. You take that 28 days, and then then food, you feel like you expose yourself food, maybe you expose yourself, again you take food to waleka. How does that look? This is a person who's defaulting.
And defaulting.
You see? Wamwa waleka. You already had the virus, right? Wamwa waleka. Yuja muntu ametima kambati as a treatment in muntu watu. Aleka. Futa ayamba mwako futi 28 days aleka. You've been taking medication and you're defaulting. You default and then you start having now bigger problems. Watu gone kako twakauka manje tupoya na mpamvu. Watu gone kako. I think that's the simplest way I can.
One last question. Does PEP have side effects?
Every drug has side effects, depending on your system, but minor ones.
Okay.
Minor ones, maybe to a headache, something that you can work on. So, even Panadol itself.
Alright. So before
you PEP, PrEP, first line, second line, they are not strange drugs. They are actually the same drugs and many are medicines, apart from your made true VADA, okay? For PEP. Otherwise, PEP ask me, PEP. It's the same TLD that we give people to treat HIV.
The only drugs the same. The only drugs the same.
Answered you.
You've answered
So when you say, does it have side effects? These same drugs within the system, and that's why I said side effects are just minimal, depending on how your body will respond. Something that can be manageable.
Okay. So I want us to get clear on this between PEP and PEP. So PEP, you say that you can drink it for 1 month,
28 days.
28 days just for
Immediately when you are exposed.
Immediately when you're exposed.
Yes.
You have to start it within 3 days.
72 hours.
72, which is 3 days.
3 days. You
How
have to
many
start.
day continuation until 28 days?
Yes.
And then,
So that's 23 days is just a period where you know that you have to take it. In that time, American body invade virus before it penetrates.
okay.
Yeah. So you have, that's the only time you can block it.
Correct. Same as my morning after.
Morning after is instant.
Instant.
Okay.
I'm
Okay.
much better man.
Okay. The topic for morning after will be another day.
Yes.
Topic for family planning, as the table is already set here, we'll do this another day. As you can see, my
You have a
consultation
client.
room is busy.
Okay.
So thank you for your time.
For morning after talk it maybe on Friday.
We'll combine it with
Okay.
all different types of family planning.
Okay, just to wind
Alright.
up. PrEP what is within 3 days you have to start.
That's PEP.
PEP, P-E-P.
PEP.
P-E-P. P-E-P.
That's the way the meal.
Post-exposure
Exposure.
prophylaxis.
That's the one you have to start within 3
Yes,
days.
post-exposure prophylaxis, PEP.
Okay.
That's the one you need to start immediately when you are exposed. Within the time of what?
3 days.
72 hours.
Okay.
All right. And then continuation up to 28 days.
Okay.
Yes. Could you bear with me, Sanai?
Okay. and
Then pre-exposure,
PrEP.
PrEP.
Yes.
That's the one you start when you are ready to start. Okay?
Oh, that one when you are ready to start, you can start it.
Yes.
Maybe within a year.
You can't be
Wait,
exposing
wait,
yourself
what?
and then you wait for a year. Okay?
Like you can, when you start and then you can drink it within a year.
Yeah.
Even for the rest of your life.
Alright, as
For as
you're
long as you're
exposing
exposed
Yes.
to whatever type of exposure that you're exposing yourself.
yourself. Alright.
Yes.
Get your body now.
And then when you feel yourself, you're out of exposure.
You can stop. Alright.
And then pre-exposure, this is for a man. This is where for a man, like I explained, before you freely start exposing yourself, you have to wait for how many days? 7 days. That's when it becomes effective.
Okay.
And then in females, 21 days.
21 days, which is 3 days.
3 weeks.
Alright.
Are we good?
I think we are good now. We are good. We are clear on the questions. Right?
Yes.
No questions on this time.
Okay.
Alright, guys. Thank you.
Thank you.
Thank you, Sister Lorraine,
See you
for
next
coming.
time. Alright.
Thank you.
Alright.
See you again on Friday, guys. Bye.